My hospital medicine team comprises of physicians and advanced practice providers. We are the primary admitting physicians for patients that get admitted to St. Joe's in Ann Arbor, St. Joe's in Livingston, Chelsea, and Livonia. Our ICU team is the one that has taken the biggest brunt of this. That team has been caring exclusively for COVID patients since spring of 2020.
Those first couple weeks, it would take 5-7 days to get a confirmed test. But you would see more and more patients just keep coming in, and they were coming in faster than they were going home. And you would see reports come from Italy where it was just getting worse, and we were worried that that's what was going to happen here too. And to some degree it did.
In May, we had upwards of 2,000 COVID admissions to the hospital, and mortality rates that exceeded 50% in the ICU.
That initial wave, I felt like I was walking into a burning building every day, and everything around me was on fire, and I had no way of putting out that fire.
We were having so many patients getting intubated, rapid responses called, code blue situations, and it did seem a little bit sometimes futile. It was a little bit scary.
And then Surge 2 came. We were really tired by Surge 2, and the healthcare providers started to get sick during Surge 2.
We have the same fears that everyone had, and I'm going in to see this patient with this new disease that nobody really knows how to treat. I have family at home, am I gonna get sick and take it to them?
There was always that thought of not when am I gonna, or if I'm gonna get it, but when am I gonna get it? And when am I going to take this home to my kids and my parents and my 90-year-old grandmother?
But it was kind of, we're going to do as best as we can to help the patients we can.
It was also on the horizon of hope for us because the vaccine was hitting the market.
Our providers were among the first to get vaccinated. So I still remember the day when there were the first set of providers that were getting vaccinated, and we had 2 of our team members among them. It was a sense that this might be the beginning of the end.
I was there in the lobby of St. Joe's Ann Arbor when they started giving the first doses out, and everyone was kind of in a much better place for a few weeks.
I think one of the brightest lights in my time during this was the day I got my own vaccine. Just feeling like somehow that honored all of the people that we had lost. No matter how I felt about the vaccine or people around me felt about the vaccine, I thought about every person we lost during COVID and thought, some of them died before they even had this choice. So how could us as providers not be the first ones in the chair getting that vaccine and just doing something to honor the thing they never had a chance to have that very likely would have saved their lives. Yeah.
When the third wave came in April 2021, it was very hard for the team.
We all had so much hope that this was over and the world was going to change. And then you had these poor parents who were coming in sick and dying because their kids were doing what kids do and just trying to be normal.
One of the most difficult parts of caring for COVID patients is the fact that they're alone.
When patients are sick like that and families weren't even allowed to come to the bedside.
It was hard, having to call families and tell them their loved one is declining and things weren't looking good. And we had these conversations, not just daily, but multiple times a day with so many people. And you could hear the hurt in their voice, but really couldn't do anything to console them.
We were the only connection that they had to that person. And we made a commitment as a hospitalist team, not just in the ICU, to call every patient's family every single day. And I think it's the biggest difference we made during an illness that we couldn't always make a difference for. I think through all of this, one of the unifying things has been the support that IHA has given all of us.
I think being physician-led, they know what it's like to be in our shoes. And so when we are asking for things, there are things that we genuinely need. The response is really good and really quick, and we feel like we're heard.
The outpouring of support from leadership, from other team members who instead of running away from COVID because they were outpatient providers, were running into the hospital to help us. And that is the things that we have hung on to every single day when we've been over there. It hasn't just been a hospital's problem, it's been everybody's problem, and the support and outpouring has just been overwhelming.
We learned about how resilient we all were. We also proved the value of hospital medicine and the remarkable care that we provide to all our patients from the moment they come into our door through all phases of their illness. And the value of our specialty has really come out here. It is also the importance of coming together as a healthcare community, because we wouldn't have been able to do this by ourselves, right? It takes a village to get through some of this, and it highlights that these moments of crisis are where we all come together and overcome this.